No.
Can you enable screen sharing so that I can
Okay.
my screen?
Okay, it's done.
Okay, thank you. Okay, sorry about that. So the fungus becomes susceptible to other components entering the cell, and then it's unstable. Okay, so fluconazole is used to treat candidiasis, mainly of the mouth, the throat, and then esophageal candidiasis. So mainly in HIV patients. And then also for cryptococcal meningitis. And itraconazole is used to treat other fungal infections like blastomycosis, non-meningeal histoplasmosis, candidiasis, and then fungal nail disease. And voriconazole is used to treat aspergillosis. So the drug interactions here too, you have increased risk of bleeding when you take anticoagulants. And then fluconazole may increase the activity of zidovudin. So it's important to note that zidovudin is one of the antiretroviral drugs. And fluconazole is used to treat fungal infections, which are common in patients with immunosuppression, for example, HIV. So whenever you are giving these medications, you have to take notes of some of these things. Then itraconazole and voriconazole may also increase the risk of bleeding. And then the same issues with antacids and medications that decrease gastric acidity. And then when you are given this medication with medications that are used for antiarrhythmias, like the quinidines, there's increased risk of QT interval prolongation. So there might be some ECG changes. So adverse reactions, it's important to take note of the elevated liver enzymes and then the rash. And it's also important to take note of the vision disturbances with regards to voriconazole. Here too, there's elevated liver enzymes. So clotrimazole is also very common, and it is used to treat topical dermatophyte and candida infections, and then orally to treat candidiasis, and then to treat vaginal candidiasis. Griseofulvin is another common anti-mycotic drug, and it is commonly used to treat tinea of the various parts. So tinea capitis, tinea anguim, tinea corporis. And usually, to prevent a relapse, you have to give the griseofulvin continuously until the infected skin or nails are replaced. So usually, you give griseofulvin therapy for at least 6 weeks, so that by that time, the skin and the nails that are infected would have been replaced by new growth. Miconazole is also another antifungal medication that is used to treat local and also candida of the mucous membranes and the skin. So for example, oral thrush. It can also be given IV to treat fungal meningitis, and it can also be used to treat fungal bladder infections. So the glucan synthesis inhibitors. The prototype here is caspofungin, which is a new class of agents. And its major use is in a patient who hasn't responded to other systemic antifungal therapies like amphotericin B or itraconazole. So it is not used as a first-line drug. It is given intravenously. It is highly protein bound. There's little distribution into the red blood cells. It is slowly metabolized and it's excreted in the urine and the stool. So what it does is that it inhibits the synthesis of beta 1,3-D glucan, which is a part of the fungal cell wall. Take note that the others usually inhibit ergosterol synthesis, which is part of the fungal cell wall. Some of them also inhibit pyrimidine RNA synthesis, but this particular one inhibits the glucan as part of the fungal cell wall and leads to the destruction of the fungi. So what happens is that the caspofungin is used to treat invasive aspergillosis, and it is not the initial treatment. It is usually used as a second line. And if you are taking the caspofungin with tacrolimus, you may need to give higher doses of tacrolimus. So tacrolimus is a medication that is used as an immunomodulator. Then certain medications like phenytoin and carbamazepine, as well as the antiretroviral drugs, efavirenz and nevirapine, as well as delfinavir, may lower the dosage, the clearance of the caspofungin. So what's happen is that there'll be increased levels of the caspofungin in the blood. And when you give them together with cyclosporin, you would have elevated liver enzymes. So it's not recommended that you give them together. So some of the adverse reactions are paresthesia, that is burning or prickling sensation of the skin, and then facial swelling, in addition to the normal GI side effects. The last one we'll look at is the synthetic allyl amine derivatives. So the commonest is terbinafine, and it inhibits fungal cell growth by inhibiting the enzyme responsible for the manufacture of ergosterol. So you realize that a lot of these antifungals have inhibition of ergosterol as a common function. It is well absorbed. It's better when it's taken with food, similar to fluconazole. It is extensively metabolized, and a lot of the drug is excreted in the urine and changed. So the specific enzyme that terbinafine inhibits is called squalene epoxidase, which blocks the biosynthesis of ergosterol. And we know that ergosterol is an essential component of the fungal cell membrane, and this leads to loss of integrity of the cell membrane. It is used to treat tinea anguim, which is tinea of the nails. So either the toenails or the fingernails. Similar to Griseofulvin, which is also used to treat tinea. So when you take cimetidine with terbinafine, it decreases its clearance. And then its clearance is increased when it's taken with rifampin, which is an antifungal medication. Then when you take it with dextromethorphan, which is commonly found in cough syrups, there is an increased plasma level. So adverse reactions, you have headache, visual disturbances, and it's very important to take note of the Stevens-Johnson's reaction or Stevens-Johnson syndrome, where they have peeling and ulceration of the mucous membranes, as well as rashes on the skin. A very important adverse reaction is liver failure. And so it's very important that if you have a patient who is suspected of liver disease, avoid using it. And it's also important to get a liver function test before you start the use of this medication. Okay. Are there any questions? Are there any questions, please? Yes.
Please, you were saying that the Miconazole, you use it for 6 weeks before for you to get a new toenail before the treatment.
No. No, it's not myconazole. It's Griseofulvin.
Oh, okay. But
Yeah.
but madam, why would you have to use it for that long?
But that's how long it takes for the new toenails to grow.
So can't you stop the usage and then the toenail will grow, or there might be relapse of the
No,
infection?
so the toenail has the fungus in it. So you give it until the fungus, the old nail outgrows it.
Okay.
I don't know if you understand what.
Okay, so that
So
it's
that
cleared from the skin.
yes, so it is cleared from the nail.
Okay.
Yeah.
Thank you.
All right.
Hello,
Are there
madam.
any other? Yes.
Miconazole. Is it always advisable to give it just as a single dose in the management of vaginal candidiasis?
Yes, that's the dosage. That's how it's treated. If you want to treat esophageal candidiasis, then that one you give it for 2 weeks. So if it's vaginal candidiasis, 1 dose is enough. And then you continue with topical.
Madam, even if it's a recurrence, you still have to give a single dose.
So if there's recurrence, there are other factors that are contributing to the recurrence. For example, the hygiene, the state of the underwear. Maybe the patient treated and went back to use their old underwear. So you have to advise that there has to be advice in addition, how to care for the underwear in terms of drying it in the sun and using cotton underwear, which is able to absorb moisture so that the place doesn't become wet. All these things could be the reason why there's recurrence, not because the medication is not working. I hope you get it.
She has to buy new panties. She has to buy new panties.
Yes.
She has to throw her old ones
Yes.
away.
Yes. And then it's important to dry them in the sun and then ensure that the panties are cotton and not nylon. So there are all sorts of things. The patient also needs to use, they can also use panty liners, which they discard after use so that there's no persistence of any fungal elements. So there are so many factors which accounts for recurrence. It's not just the fact that the medication didn't work.
Okay, madam. Thank you.
All right. Any other questions? Any other questions? Hello?
No, madam.
Are we okay?
Hello. Yes, madam, you're
Yes,
Okay, so
yes,
I'll send it to you so that you can go through. Okay, have a good night.
you will try.
You try and have a good night.
Have a good night, madam.
Good night, so yeah, try. You have to try.
Yes, ma'am.
Okay. Bye.
Bye.